The scale of the task is enormous. France has long prided itself on its universal healthcare system, but disparities in access remain a growing issue. To meet the 2027 deadline, the government will need to act quickly. Funding must be secured, regional health maps drawn up, and partnerships forged. Moreover, healthcare is not just a national matter, but also a European one. Neighbouring countries face similar struggles, with ageing populations, rural depopulation, and physician shortages. France's success or failure could set an example for others grappling with the same crisis. Opposition leaders have already begun questioning whether Lecornu's plan is achievable. Some argue that without radical reforms to medical training and distribution, the pledge risks becoming another in a long line of unfulfilled promises. Others suggest that digital health solutions, while promising, cannot fully replace the physical presence of doctors and nurses. For Sébastien Lecornu, the Mâcon trip was more than a policy rollout. It was a moment of definition. Standing before the cameras, he did not shy away from setting a concrete target, knowing that he would be judged against it. The symbolism was powerful. A young prime minister, less than a month into office, standing in a provincial health centre and promising that by the end of his mandate, no French citizen would be more than half an hour away from care. Whether the France Santé network becomes a transformative reform or another unrealised ambition will depend on the coming years. But in Mâcon, on this September morning, Lecornu planted a flag for his government's priorities. As the visit drew to a close, Lecornu lingered with staff and patients, offering reassurances and listening to concerns. The day's events, though modest in scope, carried weighty implications. France's healthcare system, stretched and uneven, has long been in need of bold reform. By announcing the France Santé network, the Prime Minister staked his credibility on a promise that touches the daily lives of millions. And so what I'm going to ask the ministers and the government is to create a France Santé network, he said. By 2027, we must have a local healthcare offer, around 30 minutes from your home. For now, the words stand as both an aspiration and a challenge. Mâcon, with its mix of local tradition and national symbolism, may someday be remembered as the place where a new chapter in French healthcare began.